You're standing in your kitchen late in the evening, the house is quiet, maybe the television is on in the background, maybe it's completely silent. You warm up some leftovers, sit down for a quick meal, and take a bite a little too fast because you've eaten this same meal 100 times before. Then suddenly, something feels wrong. The food doesn't move down the way it should. You try to swallow again, but it feels stuck. You cough once. Nothing happens. Your chest tightens. Your eyes water instantly. You try to pull in air, but only a tiny amount comes through. And in that moment, something changes emotionally too, because you realize there's nobody else in the room, no one standing beside you, no one across the table, no one nearby asking if you're okay, just you. Now here's what many people do not realize. In situations like this, the first few seconds matter more than strength, age, or even luck. What matters is whether your brain stays calm long enough to remember what to do next. I've spoken with many older adults who went through moments exactly like this while living alone. And the people who handled it best were usually not the strongest people. They were the people who stayed focused long enough to act instead of panic. Today, I want to walk you through 7 techniques that can help if food becomes stuck while you're alone. We'll go from the simplest and most important mindset techniques all the way to the stronger physical methods people have successfully used to help clear an airway emergency. And I want you to stay with me until the end because the final technique is the one many people say gave them the best chance when nothing else worked. But first, it's important to understand why this topic matters even more after 60. As we get older, swallowing changes more than most people realize. The muscles involved in chewing and swallowing may not react as quickly as they once did. Some medications can make the mouth and throat feel dry. Dentures can reduce how clearly food texture is felt while chewing. Even distractions like television or eating too quickly can increase the chance of a problem. Many older adults assume choking only happens in restaurants or during large meals, but a large number of incidents actually happen quietly at home during ordinary dinners, and often the person is alone. That's why preparation matters so much. Tip number 7 is something that sounds simple, but it may be the most important step of all. The 3-second mental reset. When people panic, the body immediately floods with stress hormones. Thoughts become scattered. Some people begin pacing. Some grab wildly at their throat. Some waste precious energy trying to run for help instead of acting immediately. I once heard a story from a retired man in his early 70s who experienced this while eating sliced fruit in his kitchen. His first instinct was to rush toward the front door, but after only a few steps, he became dizzy and had to grab the edge of the table to steady himself. And in that moment, he remembered something his daughter once told him during a first aid discussion. 3 simple words: stop, think, act. And that short phrase interrupted the panic long enough for him to focus. And that is exactly why I want you to choose a phrase now while you're calm. Something simple. I know what to do. Stay calm. Stop, think, act. Whatever feels natural to you. Repeat it a few times over the next few days, because in a stressful moment, the brain often reaches for what has already been practiced. Tip number 6, call 911 immediately, even if you cannot speak. A surprising number of people believe there is no reason to call emergency services unless they can explain the situation out loud. But dispatchers are trained to recognize silent emergency calls. If you call and leave the line open, help may still be sent to your location. And if you can make any sound at all, tapping, coughing, knocking on a counter, that can help communicate that something is wrong. This is also why many people over 60 are encouraged to keep a phone nearby during meals, not charging in another room, not upstairs, not buried in a bag, nearby and reachable. Making that call takes only a few seconds, and it means help may already be on the way. while you continue trying to clear the blockage yourself. Tip number 5, lean forward at about a 45-degree angle. This sounds small, but it changes the direction gravity is working. Many people instinctively lean backward when choking begins. Unfortunately, that can sometimes make it harder for the object to move out. Instead, stand up if you are seated. Hold on to a counter or chair if needed for balance. Then, bend forward slightly at the waist so your chest angles toward the floor. Forward and down. That position helps gravity work with you instead of against you. Stay in that position during the next techniques as well. Tip number 4, the power cough. Not a weak throat cough, a deep, forceful cough using the muscles lower in your body. While leaning forward, try to take in whatever small amount of air you still can. Even a tiny breath may be enough. Then tighten your stomach muscles firmly and push the air out in one strong burst. Think about trying to force air from deep below your ribs instead of just clearing your throat. One powerful push at a time. Not rapid, weak coughing, short, strong bursts. Sometimes people feel the food shift after only 1 or 2 strong coughs. If that happens, continue immediately, because movement is a good sign. Tip number 3, using a sturdy chair for self-thrusts. If coughing does not clear the blockage, move to a solid chair with a firm back. Not a soft couch, not a rolling chair. A stable dining chair or kitchen chair works best. Position the top edge of the chair just above your stomach area and below your ribs. Then hold the sides of the chair and press your upper body firmly forward and downward against that edge. The goal is to create pressure upward inside the body, similar to the pressure used during assisted abdominal thrusts. Do several strong thrusts. Do not worry about bruising yourself. Temporary soreness is far less important than restoring airflow. Pause briefly between attempts to see whether breathing improves. Tip number 2, back impact against a wall or door frame. This technique works differently because instead of forcing air upward from below, it uses vibration and impact to help loosen the object. Stand with your back facing a wall or sturdy door frame. Then strike the upper part of your back, the area between the shoulder blades, firmly against the surface, not gently, with intention. Many people alternate between this technique and the chair method. A few chair thrusts, a few firm back impacts, then repeat. And now the final technique, the floor drop. This is the strongest self-rescue method many people describe learning later in life, and it is the one I most strongly encourage older adults to understand ahead of time rather than trying to figure it out during panic. Here's the basic idea. You position pressure beneath the upper stomach area and use your own body weight to help create a strong upward burst of air. To practice the positioning gently, kneel on the floor. Place your hands in front of you. Then make 2 fists and position them one over the other beneath the upper stomach area, above the belly button. The important thing is understanding placement and body position before an emergency ever happens. Many people who successfully used this technique later said the same thing afterward. My body remembered what to do. And that matters because panic makes clear thinking difficult. One older woman described experiencing a severe choking episode while eating dinner alone at home. She first tried coughing. Then she tried using a chair. She felt the blockage shift slightly, but still struggled to breathe comfortably. Finally, she lowered herself carefully to the floor, used the positioning she had practiced months earlier, and after several attempts, the blockage cleared. What stayed with her most afterward was not fear, it was relief. Relief that she had taken the time to learn what to do before she ever needed it. And honestly, that is the reason for this entire conversation today. Preparation creates calm. Now, before we finish, I want to give you a simple 4-step prevention routine because preventing choking is always better than reacting to it. First, cut foods smaller than you think necessary, especially tougher foods like meat, apples, grapes, or firm vegetables. Second, slow down while eating. Many people over 60 eat while distracted, watching television, reading, or standing in the kitchen. Slowing down and chewing thoroughly makes a real difference. Third, drink water regularly during meals. Dry food combined with a dry mouth is a combination many older adults underestimate. And fourth, pay attention to medications that may cause dry mouth or swallowing discomfort. If you notice persistent dryness while eating, it may be worth discussing with a healthcare professional. So, let's quickly review. Stay calm first. Use your mental reset phrase. Call emergency services immediately if needed, even silently. Lean forward. Use strong, controlled coughs. Try chair thrusts. Use firm back impacts against a wall if needed. And remember the floor positioning technique as your strongest option when other methods are not helping. Most importantly, do not wait until a stressful moment to think about these things for the first time. A few minutes of preparation today can make a tremendous difference later. And if you know someone who lives alone, especially an older parent, neighbor, or friend, consider sharing this information with them too. Sometimes the most valuable conversations are the ones people hope they never need. Thank you for spending this time with me today. Take care of yourself, stay aware during meals, and I'll see you again in the next video.